Hello and welcome to our daily update on COVID-19. It's March 23rd, Monday. I'm Suraksha. It has been almost 2 months since the first case was detected in Kerala, and today the state saw a huge spike in COVID-19 cases. In the next few minutes, we will bring you updates regarding the spread of this virus from across India with specific focus on Bengaluru and Karnataka. At the time of recording this video, 478 people have tested positive for the novel coronavirus. There's an increase of 90 cases since yesterday. West Bengal reported its first death due to the virus today, and with this, the total number of deaths has gone up to 8 from 7 yesterday. Kerala reported 28 positive cases today alone and has now overtaken Maharashtra with a total of 95 COVID positive cases. The government has announced total lockdown in the state to prevent the spread of the epidemic. Hostel rooms and government institutions will be turned into corona care facilities. Maharashtra has 89 positive cases. The state has also announced a lockdown in an attempt to prevent the spread of the coronavirus. Mumbai Bagh protests that was on since 26 January midnight has been called off. Karnataka reported 7 new cases of COVID-19 today, and the tally in the state has now gone up to 33. It was 26 yesterday. The state has the third highest number of confirmed cases in the country. The Chief Minister extended the lockdown from 9 affected districts to the entire state late this evening. Among the cases confirmed today, patient number 27, 28 and 33 have a travel history to Dubai. Patient number 29 came to the city via London. Patient number 30 is a resident of Bengaluru but contracted the virus from her husband, who is patient number 17. Patient number 31 has a travel history to Dubai and London. Patient number 32 has a travel history to Germany. Contact tracing has begun for all cases. Following the lockdown, except for essential services, all commercial establishments will be shut down. Those who have returned from overseas travel are under strict orders for home quarantine. Gathering of more than 5 people will not be allowed. All religious gatherings have been stopped. IT/BT workers must work from home except those in critical units. All passenger transport services, including interstate and inter-district, has been stopped. This is important. Private vehicles will not be allowed on the roads unless it is to procure essential commodities. Ola, Uber, auto and taxi services are barred from passenger services. Government offices that do not provide essential services will be closed. State borders will be closed for passenger traffic except medical emergencies. Essential services such as groceries, chemists, medical services, petrol pumps, banks and ATMs will function as usual. E-commerce delivery and home delivery from restaurants will also continue to function. Moving on, at the centre, the Rajya Sabha and Lok Sabha adjourned sine die in view of COVID-19. The Lok Sabha passed the finance bill without a discussion and adjourned the session amid demands from the opposition for a financial package to tackle the spread of the epidemic. The Supreme Court has decided that it will hear matters of extreme urgency but through video conferencing only. A decision on whether the Supreme Court will take a break for a vacation will be decided soon, as it will have an effect on filing the cases which are time barred. Also, in Delhi, the All India Institute of Medical Sciences has decided to shut all outpatient services till further notice. In a move to prevent the spread of novel coronavirus, the operations of domestic commercial airlines will be stopped from the midnight of March 24th. That is from midnight tomorrow until further orders. All domestic flights have been asked to plan their operations so that their flights land before midnight tomorrow. These restrictions will not apply to cargo flights. The Indian Railways had earlier suspended passenger train operations until March 31st. With the number of COVID-19 samples swelling, the Indian Council of Medical Research last week decided to rope in around 50 private labs to help increase the capacity of diagnostic services. Neuberg Anand Reference Laboratory in Shivajinagar, Bengaluru is the first private lab in Karnataka to get the approval of the Indian Council of Medical Research for testing COVID-19 samples. The lab has a capacity to test 100 samples per day and expects to be ready for testing by Tuesday evening. The lab will test samples from nursing homes and hospitals. Walk-in patients who fall under the testing criteria set by ICMR can use the facilities of the lab. According to the current criteria, anyone who has a history of overseas travel in the past 14 days can get tested. Those who have been in direct contact with these passengers can also get tested. If the patient has no travel history but is in the hospital with symptoms of respiratory illness like pneumonia, he or she can be tested. Apart from Karnataka, 5 private labs in Maharashtra, 2 each in Haryana and Tamil Nadu, and 1 each in Delhi and Gujarat have been cleared for COVID-19 sample testing. As per the guidelines laid down by the ICMR, the labs will not charge more than 4,500 rupees per test, that is 1,500 rupees for the screening assay and 3,000 rupees for the confirmatory assay. DRDO will join efforts to test samples for COVID-19 after the lockdown ends on March 31st. Screening and detection will start in Bengaluru and Karnataka. PM Narendra Modi urged citizens to take the lockdown seriously following reports that many individuals ignored social distancing by thronging on streets after the Janata curfew yesterday. Various state authorities are continuing to come up with new measures to contain the spread. Arunachal Pradesh has ordered a statewide lockdown from Monday evening till March 31st. All essential services will continue to operate. In Delhi, the AAP government told the Delhi High Court that it has decided to decongest prisons by giving special parole to prisoners. The Delhi government has also instructed its district magistrates to ensure that around 35,000 people who return from overseas travel since March 1st remain in home quarantine for at least 14 days. Anyone violating these directions will be booked under Section 188 of the Indian Penal Code. The Delhi High Court as well as the district courts will suspend functioning until April 4th. Uber has suspended services in Delhi NCR and 27 other cities in Gujarat, Jharkhand, Maharashtra, Punjab, Rajasthan, Andhra Pradesh, Telangana and Uttar Pradesh. For details, consult the Uber blog. Moving on to Bengaluru, the police said if people step out unnecessarily, they will face arrest. Bengaluru Police Commissioner Bhaskar Rao has said that around 5,000 people have been stamped with home quarantine seals so far. Citizens can call number 100 if they find anyone with a seal loitering around, following which the violators will be put under government quarantine. In Bengaluru, audience who attended Mir Mukhtiar Ali's musical concert on March 12th at Chaudhaya Memorial Hall are requested to inform helpline numbers voluntarily to enable contact tracing. The advisory is being issued in view of a member of the audience testing positive for the coronavirus. A war room has also been set up to monitor 43,000 people who returned to the city from overseas travel between March 8th and March 19th. The BMTC has suspended operations of AC buses until further notice. The Karnataka Waqf Board has suspended prayers at all mosques across the state until March 31st to prevent the spread of Covid-19. CM Yediyurappa has announced that Indira canteens will serve free food to benefit the poor amid the Covid-19 scare. As more cases continue to be reported every day, heads of 20 private medical hospitals met Chief Minister BS Yediyurappa today and have divided responsibilities with the state to control and treat the spread of the epidemic. The Chief Minister suggested setting up of 30 fever clinics where preliminary checkup can be done. The private medical establishments have come forward to spare the services of their doctors and clinical staff. They have also agreed to spare more than 100 ventilators. State Health Minister B. Sriramulu announced that Karnataka will purchase 1,000 ventilators from Mysuru company Scanry. The same company had come under the scanner for tax violations last year. CM Yediyurappa had announced yesterday that purchase of 500 ventilators was underway. The health minister also announced that the government would be purchasing 10 lakh masks and 5 lakh units of personal protective equipment. Sriramulu did not mention which vendor would be supplying the masks and personal protective equipment and at what rate. As tighter enforcement of the lockdown continues in various parts of the country, the economically weaker sections have been particularly hit hard. In Maharashtra, the Jan Swasthya Abhiyan urged the municipal corporations in the Mumbai metropolitan region to work in coordination with various stakeholders to put together a comprehensive public health strategy which must include free medical services to the poor. The lockdown and other strategies of social distancing that have been implemented so far have created severe economic distress for the poor and those in the informal sector. 41.3% of Mumbai's population lives in slums and has over 2.5 lakh homeless people. The Jammu and Kashmir government has issued an advisory that there should be no termination or reduction in salary of any employee who goes on leave in this period. The government of Karnataka has also issued an advisory stating that all labor-intensive industries should work at 50% of their strength on rotation basis. It further advised that no worker should be removed on this account and paid leave must be sanctioned to the rest. The Confederation of Indian Industries has predicted that India's growth, which has been going through a slowdown, may fall further. The CII urged the government to consider a strong fiscal stimulus to the extent of 1% of the GDP, amounting to 2 lakh crores to be given to needy citizens through Aadhaar-based direct benefit transfer. This would amount to 10,000 rupees for each individual, especially the rural and urban poor, and 10,000 rupees for the most vulnerable section, the elderly. According to the periodic labour force survey, there are more than 20 crore casual labourers who might benefit from this. Among other recommendations, the Director General of the CII has asked for a corpus to support MSMEs tied over the crisis. That's all we have for today. Stay indoors, stay safe. For detailed coverage and the latest updates on COVID-19, log on to www.deccanherald.com.